For as important as our health is, what it takes to stay healthy is not straightforward, simple, or in many cases affordable. This week, we look at healthcare in America.
Do I get healthcare for my child who needs a transplant? Or do I make sure that we can stay in the United States?
From what insurance gaps do to minority communities, to the division over whether abortion is healthcare.
Whichever she chooses is going to be life-changing for her.
This is The Race. I want to start with a stat that surprised me when I first heard it. That 40% of adults in the United States have dealt with some kind of medical debt. That's according to a recent study by the Kaiser Family Foundation and NPR. That means that many people that you come in contact with every day have likely dealt with this problem. And that's why I want to do our first story as one that can hopefully help you better navigate the complex world of healthcare and the costs that come with it.
So this is some of what I have.
Bear with me because Shelby Rickelman's story is complicated, but she thinks it's important you hear it.
I've done everything right. I have no credit card debt. I pay all my bills on time. Like, this isn't fair. That one mistake has put me in bankruptcy for the next 10 years of my life.
Shelby has Lyme disease. Her husband is an Army veteran. Military insurance called TRICARE covered her medical expenses while he served. But in 2019, he transitioned to what's called Individual Ready Reserve, where he can be called upon but doesn't train with the military regularly. It allowed him to spend more time at home helping Shelby. She says they weren't told about what would happen to their coverage as soon as he went on Individual Ready Reserve.
They canceled our coverage the day he got out of the military.
The medical records she shared with me show that less than a week after her husband's transfer became official, she received IV therapy and medications for her Lyme disease.
It said it was covered.
Shelby says initially she got this bill, showing insurance covered all but $28.
Proof that I had coverage.
She even showed me this piece of paper, a screenshot from her doctor's office that said her insurance was still active at the time. Then in June of that year, she received this letter that said without insurance, she needed to pay more than $90,000. What is that moment like when you see those numbers on the bottom line?
I opened it and I was just in disbelief. I was like, it didn't feel real.
She says she called her insurance company, TRICARE, and they told her the screenshot from her doctor's office showing her coverage was active was the result of a glitch. What did they say when they see this?
They said, sorry, this was an error. It's not showing up as active in our system. I called like 12 different lawyers and they all said there was nothing they could do to help me. And I just felt really hopeless. And so I was told the best thing I could do was declare bankruptcy.
And that is what she did. Here's the filing.
So my credit dropped about 250 points. It stays on your credit report for 10 years. So I can't buy a house, I can't buy a car, can't get a credit card.
Adam Fox sees people caught in difficult situations with medical bills all the time.
People don't understand how common this is and often feel like they're isolated, that they're alone in experiencing this. And the reality is there are so many people in the same boat that are going through the same situations because it is so common.
He works for a Colorado nonprofit that has saved people millions in fighting medical debt. When I told him Shelby's story, he said the system doesn't generally see being given bad information as an excuse.
You know, at 26, you don't want to declare bankruptcy.
I reached out to TRICARE and was told a team would review the specifics of Shelby's case. She says there's not much she can do now but wait 8 more years until bankruptcy no longer shows up on her credit report. She does hope her story can be a call for change.
Seeing how broken the healthcare system was, it made me want to be open and speak about it and tell people that this can happen. You can be perfectly fine and then one little glitch with your insurance can change things dramatically.
When Roe v. Wade was overturned, a lot of states were put into limbo. So I'm in Casper, Wyoming right now because Wyoming is one of those states. They did have a trigger ban ready to go, but that ban has not been enacted yet. So I want to come here to talk to different health centers from different ideologies to see how they're preparing for that ultimate decision to be made. This small western city, known for its cowboy culture and history as a stop along the Oregon Trail, has a new spotlight cast on it. It is being viewed now as a microcosm of the differing perspectives on reproductive health and choice, views that, for many, clash in a post-Roe America.
It's just really been a wild ride. It's been depressing to see that what we've worked so hard for in this country has come undone.
What Julie Burkhart has been working to build represents one side of the fight. She runs the nonprofit Wellspring Health, which built this clinic set to be the first in conservative Wyoming to offer surgical abortions.
On May 25th, the clinic was firebombed.
A week before it was set to open earlier this year, the fire happened.
We're determined. You know, we made a commitment to come into Wyoming and to provide reproductive health care services.
Julie is working on rebuilding, but there's a bigger hurdle standing in her way. Wyoming is one of 13 states with trigger bans, laws that ban abortion that were set to go into effect as soon as Roe was overturned. However, at the moment, 8 states have banned abortion. Bans in 5 states are temporarily blocked by courts, and bans in Wyoming, Idaho, Tennessee, and North Dakota are pending legal reviews that could be finished any day.
We're looking at potential litigation if that is certified, but we're waiting to see what the state of Wyoming is going to do. My biggest fear is that, you know, women and people who do not have the resources and the means, people of color, are going to be even more disenfranchised and suppressed in this country.
So this little one is about 12 weeks, 5 days into the pregnancy. And so you've got actually a really nice profile.
This is a turning point in her life. This is, whichever she chooses is going to be life-changing for her.
Across town is True Care Women's Resource Center, a faith-based medical clinic offering free pregnancy tests, ultrasounds, and connections to financial and other resources for those who do choose to carry a child to term, running off community donations. This is the other side.
We just say the best decision is an informed decision.
Once the news dropped about Roe, Executive Director Jessica Baxter said they began thinking about what an increase in clients would look like.
We had been preparing for that decision for a while and having the discussions about, will we be expecting more women to come through our doors? What will that mean for our staffing? What does that mean for our budget?
Pregnancy care centers like True Care have also been in the spotlight and under scrutiny from pro-choice advocates arguing their primary mission is to discourage abortions.
I really believe that the greatest misconception about us is that somehow we're trying to coerce a woman into a decision. And it's not what we do. It's not our goal when we walk in this door.
Baxter says their mission is to educate about all options in an unwanted pregnancy and hopes that with the news about Roe comes a greater interest in the type of services they offer.
Our desire as an organization is that people would know that we care for the woman, her family, and the baby that she's carrying. They're all important to us. We want to give her that information, those options. That's what I would hope for every woman in our country.
2 sides with different perspectives, part of a discussion that will continue in this country. In Casper, Wyoming, I'm Vanessa Mashanya.
The race continues next.